Hello, my name is Elise Huey, and I will be presenting the history and background of retinitis pigmentosa. So first off, I'm going to talk a little bit about what is retinitis pigmentosa. Well, retinitis pigmentosa is a genetic disease first discovered and described in 1853, but the name was not attached to the disease until 1857. The word retinitis means inflammation of the retina of the eye, and pigmentosa relates to how and what we see. This name, which I will be shortening down to just RP for the sake of the presentation, was first applied by a Dutch ophthalmologist F.C. Donners in 1857. It is the phenotypic description of hereditary and progressive dysmorphies of photoreceptors in the retina. Nowadays, this disorder affects 1 in every 4,000 people in the United States and approximately 1 in 5,000 worldwide, making RP the most common inherited disease of the retina. And here I have a picture of F.C. Donders that was the discoverer of this disease. So now I'm going to just give a brief overview of some of the general symptoms of RP. So the symptoms of this disease often start in childhood with impaired night vision or dark adaptation. Progressive loss of peripheral vision is common, resulting in a tendency to trip over things, for example. And the longer the disease develops, the more likely the affected individual will lose their central vision later in life. And this eventually leads to impaired sight over time. Although the age of experiencing these symptoms vary, usually these symptoms are seen early on in a child's life as opposed to when they are older. Doctors can see the first signs of RP in affected children as early as age 10. As RP affects the retinal rod cells first, usually the first symptom patients notice is that they don't see as well as people without a sight condition in dim light, such as outside at dusk or at night. This is often called night blindness. People without a sight condition can usually fully adapt to dim light in 15 to 30 minutes. But if you have RP, it will either take you much longer or it won't happen at all. Patients start having problems seeing things in their peripheral vision as well. They may miss things on either side of them and might trip over and bump into things that they would have seen in the past. As RP progresses over time, most patients gradually lose more and more of their peripheral sight, leaving a central narrow vision field of vision, often referred as to having tunnel vision. It would be important to note that how long people with RP central vision is preserved will depend on how severe their type of RP is. Some patients may have their central vision preserved until their 50s, while others may lose their central vision much earlier on in life. There is no set timeline of how fast or slow the disease develops in an affected child. So here on the right, I have a picture of an individual with normal vision, and you can see in the picture on the top, you can see the retina and how it is clear, and this is how the little girl looks like in their vision. They can see the outsides of the little girl, they can see in their peripheral vision, but then people with RP cannot see anything in their peripheral vision, and this is often referred to as having tunnel vision. So now I'm just going to do a deeper dive into some of these symptoms to explain further what these mean. So I think it's important to note that though RP is usually bilateral, there have been reports of unilateral eye involvement with RP, and that means that only one eye is affected, not both. However, it is much more common to be affected in both of the eyes. As discussed previously, the first symptom of RP people generally experience is loss of night vision, which is followed by a gradual narrowing of the vision fields. Over time, depending on the severity and rate of progression of the disease, tunnel vision or complete vision loss can be a result. So, what exactly is tunnel vision? Well, tunnel vision is an extreme narrowness of viewpoint, so much so that the people with tunnel vision can only see what is happening in front of them and they cannot see anything to the sides of them. So this is shown in this up on the top of the page. is a picture of a mountain, and you can see someone with normal view can see the entire mountain, the forest, the sky, but if you have tunnel vision, you can only see a very small part of the mountain. Tunnel vision is not the only side effect of the genetic disease, because as RP progresses, other features may develop as well in the person affected, including loss of color discrimination and eventual loss of visual acuity, which relates to the ability to discern letters or numbers at a distance. I think perhaps one of the most unsettling late effects of RP is development of photopsia, which is defined as perceived flashes of light due to sensory deprivation. Patients with photopsia often hallucinate luminous objects which appear in the vision of either one or both of their eyes. These visions or hallucinations can disappear as quickly as they appear, or they could be permanent in the patient's eyesight. Photopsia can occur in the early stages of RP, but is most striking and particularly disturbing in patients with more advanced stages of the disease. In advanced cases of RP in individuals, the visual hallucinations the individuals can see take animate forms, also known as the hallucination being / looking alive and free moving. It is important to note that such hallucinations correspond with the diagnostic of Charles Bonnet syndrome, which is a form of schizophrenia. So here's just a larger picture of the example I put in the slide before of the person that has tunnel vision and their narrowed eyesight. And here's another one of someone looking out in a street and not being able to see anything in the peripheral. And here is an example of photopsia, where you see flashes of light. So this is only relating to light flashes and sensory deprivation, while this is a hallucination based on that deprivation, and it is free moving and it is animate. Okay, so now I'm going to go into a further analysis of the effect this disorder has on human fitness. RP is not a fatal disease, but it lowers the quality of an affected individual's life significantly. And the longer it develops, the more distressing the individual's life becomes. As talked about earlier, RP negatively affects human eyesight, and in no way is this genetic disease helpful or beneficial to human life. The longer an affected individual lives, the worse the disease progresses, usually causing the affected individual to become blind or their eyesight so severely impaired that they hallucinate and do not know what is really happening around them. For these reasons, the RP mutation is considered to be a very harmful mutation, and it reduces human fitness. In the wild, I hypothesized that the mutation would guarantee an earlier death in affected offspring than non-affected offspring, and for this reason, I think this mutation may be considered lethal. However, with humans, this is not the case because we live in a civilization that has medical treatments and is generally safer than the wild, so individuals in our population may live for just as long as unaffected individuals. However, as I previously stated, this mutation severely lowers the quality of affected individuals' lives and leaves them in a more distressed and disturbed state than unaffected individuals because their vision is so distorted. Okay, now I'm just going to give a very brief summary, a very brief overview of some of the way that this genetic disease can be inherited from parents to offspring. So that being said, RP is strictly an inherited disorder, and therefore it is not caused by any type of injury, infection, or other external or environmental factors. People suffering from this genetic disease are born with the disorder already programmed into their cells from their parents, who were either affected by the disease or were carriers of it. This disease can be caused by some mutations such as deletions, insertions, or substitutions, which can cause missense, nonsense mutations. So RP itself generally represents a deleterious mutation, meaning that the mutation is inherited in the offspring from the affected parents, and the development of the RP symptoms are likely to happen, but not completely certain. And that is the end of my part. Thank you so much for your time.